My name's Ken Tran. I'm a clinical assistant professor here at Stanford, just started this past August, and was previously a resident here and also a medical student here. I decided to stay at Stanford because of the culture of innovation and just the collegial culture of our department and division. I really liked our attendings here. I think our residency program here is amazing and one of kind of a world-class programs within the US and the West Coast as well, with basically infinite possibilities in terms of research as well as clinical opportunities as well. My current research focus is using computational techniques to discover abnormalities related to flow and vascular disease, with a particular focus on computational flow simulation of aortic hemodynamics after complex aortic repair. So for patients that have aneurysmal disease or aortic dissections involving the aorta, which is the main blood vessel that feeds the majority of your abdominal organs as well as your legs, those typically, historically in the past, have been repaired with open surgery, which requires prolonged length of stay, really long recovery time, very high risk of stroke, heart attacks, and things like that. In the past 2 decades or so, there's been a real big push within our field to repair these using minimally invasive techniques. That typically involves an endograft that has multiple branches or fenestrations or holes that allow you to maintain blood flow to your vital organs. But implanting these stent grafts are both complex and also change the native configuration of how the blood flow is rerouted in your body. So most of my research is focused on using flow simulation to simulate what that blood flow looks like and whether that has any long-term negative effects on the patient's health and physiology. So I was able to develop this research focus primarily because of our dedicated research time that's built into our residency program here. We have 2 years of dedicated, we call it professional development time or research time after our 3rd clinical year. And I was funded on an NIH-T32 fellowship, which is available through our institution. And I worked closely with my mentor here. I met her through our Cardiovascular Institute, which if you look up is a very extensive network of cardiovascular surgeons as well as research faculty at Stanford. Allison Mars are my mentors she is in the Department of Bioengineering. She runs the Cardiovascular Biomechanics Lab and has really developed and pioneered a lot of technology and methods using flow simulation, mostly in the cardiology space. And I was able to piggyback and use some of her techniques to apply it to vascular surgery. My hope as a faculty here at Stanford is to really leverage these techniques and start to apply it in real time, trying to optimize patient care here, particularly for endovascular aortic repair, and potentially use this in a clinical sense in terms of figuring out which patients are suitable for specific grafts, and then eventually broadening out into other fields, including carotid disease and treatment of the lower extremity arteries as well.